directed the CDC to do is that as soon as somebody is diagnosed with Ebola, we want a rapid response team, a SWAT team, essentially from the CDC, to be on the ground as quickly as possible, hopefully within 24 hours, so that they are taking the local hospital step by step through exactly what needs to be done and making sure that all the protocols are properly observed.
I play that for you, ladies and gentlemen, as we're about to introduce the Malzberg panel, because we have two security experts on, and this is still a matter of national security in my mind. And I just wanted to reassure everyone in New York City who is watching this broadcast right now that should the doctor who is back from Guinea and developed symptoms of Ebola and is now under isolation in Columbia Presbyterian Hospital here in New York City, awaiting the results of blood tests to see whether or not he has Ebola, now we know he went bowling last night in Brooklyn. Now, I don't know if he took the train, the bus, the subway, a car, but you don't get from Manhattan to Brooklyn unless you do one of those things. Let's hope he took a car, which I doubt. So he went bowling in Brooklyn. He was at a bowling alley. And today he's in isolation, and he has these Ebola symptoms. But don't worry, is what I'm trying to tell you, because Barack Obama's on the case. He's got the Ebola SWAT team ready to come. So we're all okay. Remember that. Joining us now is Senior Fellow at the Center for Security Policy and former CIA and DIA official Fred Fleitz, and CEO and founder of Red Mind Solutions, Frank Wuco. And let's start, Fred. You know, I know we're going to be talking about other things, if not this segment, the next. But, you know, just when the stock market and everybody and most Americans started to think, okay, you know, maybe this Ebola thing's not going to be so bad. You get a guy like this who's a doctor. How could he be going bowling when he's been feeling like crap and he's just back from Guinea where he treated Ebola patients?
I'm really at a loss of words. And I would add to this whole thing has been handled so badly by the Obama administration by not cutting off travel. And then Ron Klain, who's a former chief of staff to Gore and Biden, a political hack who has made the Ebola czar, has no medical expertise. I think this has really hurt the president's reputation and the people's confidence in him.
What about it, Frank?
It's incredible that something that is this great a threat to our national health and our national security, a disease that we still do not fully understand once it hits and reacts in different environments and different locales, is that any chances are taken whatsoever. As far as the doctor goes, I have no words for how irresponsible I think that is, that he actually went out in public suspecting that he might be contagious.
Yeah, that is the report that I have. Anyway, okay, let's move on a little bit and let's talk about what took place yesterday. And Frank, when you heard, and now we've seen the video and all of this, one lone gunman shooting the soldier, then racing to the Parliament building and getting, how on earth, I know someone got in the White House, but how on earth does someone get into a building like this? It's the, you know, which is the equivalent of our Capitol building.
Well, these are the risks and chances we incur living in free societies, Steve. I mean, our own White House was never designed or meant to be something that was fenced off or walled off from the citizens it's meant to represent. I've often walked by the White House myself and looked at that black iron fence and thought, wow, that's it. And then it hits you. In the United States and in places like Canada, it's a government of, for, and by the people. So there's something very odd when we consider nowadays that we literally have to wall these representative offices of the people off from the people. This was an act of terrorism.
Frank, I'm sorry, Fred, is that too big a sacrifice to make when it comes to our liberties?
Well, I sort of take a different approach on this. I don't think this was a lone gunman. I think this guy was backed by Al-Qaeda or ISIS to exploit a security vulnerability. I think ISIS and Al-Qaeda knew security in Ottawa was lighter than in London and in Washington. This guy's a thug. He's a drug dealer. He didn't think this up on his own. Either another radical Islamist in Canada was pushing him, or he was in connection over the internet with ISIS. And I think that's likely. We've seen a pattern of this happening in similar instances. So I don't disagree with what the prior speaker said, but I'll note security at the U.S. Capitol is so much more intense because of 9/11 and because we have had shooters who have gotten past security at the Capitol, and we've learned a hard lesson. Security is really tight there.
All right, guys, stay where you are because you're going to come back after I do my next chat with Daily Beast columnist and comedian and former attorney Dean Abdallah. We'll bring you guys back. We'll talk a little bit more about this and also about the recruitment efforts by ISIS and other terrorist groups and the internet and how easy it is, it seems, for them to turn people to their devilish ways. We're coming back. Don't go away.